Hello and welcome to Seaside Chats. I'm Jim Fowler, Vice President for Enrollment Management at Salve Regina University in amazing Newport, Rhode Island. And today we're here to talk about our graduate programs in healthcare administration. To have strong healthcare administrators in today's complex and dynamic healthcare environment is incredibly important. And our programs here do an exceptional job at helping professionals be relevant in today's complex and ever-changing world. And we've got a group of really wonderful people here today to talk about our program, what we offer, and why a degree in healthcare administration at Salve Regina can help advance your career or help you transition into a career in healthcare. So with me today, we have David DeJesus, who is the program director for the healthcare administration programs here at Salve. We have Jessica Marfeo, who is a current student within our program. She's also a nurse and a clinical assistant manager at Rhode Island Hospital. Thank you for coming directly from work to join us today. We have Beth Welborn, who is employee experience and well-being manager at Southcoast Health, which is an exciting job title, and we'll certainly want to learn more about that. And last but certainly not least, David Altounian, who is Vice Provost for Graduate Studies here at the university and can provide a little bit more context into why Salve is such a great place for graduate studies. But to start off with, David, I'm going to start off with you. Can you just talk a little bit about why a program in healthcare administration is so important for someone that wants to advance their career in a healthcare organization or needs to get additional skills to be more effective in the job that they have?
Sure. Thanks, Jim. What I can tell you is that what we find with our students, clinicians such as Jessica and administrators such as Beth, is that they have a tremendous amount of knowledge in their respective fields. Nurses, pharmacists, physical therapists, great deal of knowledge in their clinical areas. However, the healthcare industry is changing rapidly. And so knowledge about the industry, the finances of the industry, the ethical issues in the industry, healthcare law, all of those issues are not normally provided. And it's tough to learn on the job. So what we provide is a concentrated area in each one of those respective topics where people can learn in a safe environment, pull that information together, relate it to their day-to-day profession. And we think it's pretty successful.
And when you think about what's happening in the classroom on a day-to-day basis and relate it to your students and what they're doing on a day-to-day basis, is this a program where you kind of have to go through the entire program in order to get the benefit of it? Or do students really find that they're getting benefits from the experiences they're having in the classroom to be able to adapt it to what they're doing in their current career area from day one?
I think it's from day one, because each of the courses that are taught are relevant courses taught by practitioners. One small thing, the classroom is really Zoom. So we do it remotely, so people can do it from the convenience of their home or their office. People move at their own pace. They take courses in the sequence as they want to take in the sequence. But I think they find it relevant. So if they're taking a human resources course, an assistant clinical nurse manager has those responsibilities. A law course, a finance course, all of those responsibilities are day to day. And I think students can learn them as they're going through the program.
And when you think about the dynamic nature of healthcare today, how it's becoming more complex, more difficult, more challenging in many ways, what are some of the themes that are addressed within the courses that become really important for all practitioners of healthcare as they move into managerial roles?
So underlying all the courses are issues such as critical thinking, analysis, those sorts of skills that all professionals need. Each of our instructors are practitioners. So as practitioners, they are updating those courses on a regular basis. So our public health course 3 years ago didn't deal with COVID. And now COVID is a central issue that exists there. Our finance course 5 years ago wasn't dealing with healthcare payment reform. Now we're looking at universal health care as well as the Affordable Care Act, which has existed for a number of years but continues to be refreshed. So all of that activity happens within our each individual course, And that's the value of practitioners teaching the course, is that they are there on the front lines. They're bringing that information back and revising their courses. And their courses are not canned courses. These are courses designed by each of the practitioners and delivered by each of the practitioners.
Well, I think you touched upon the importance a couple times of having courses taught by people that are actually doing the work, that understand healthcare, that have been in the trenches doing it. And David Altounian, I want to turn to you, because one of the differentiators for Salve's programs in healthcare administration and our business programs is our IACEB accreditation. Can you talk a little bit more about why that accreditation is so important, particularly to a program like healthcare administration?
Yeah, well, I'll start by talking about what Dave was mentioning about practitioners. I think one of the things that differentiates an academic program is the fact that you have the scaffolding around an academic framework. And so unlike a certificate program where you can just go and get a healthcare administration certificate, you have the scaffolding and the requirements of an academic program. So the number of class hours, the way they're structured, learning outcomes that are defined beforehand. So as you're changing content, the content is actually still supporting the learning objectives for each course. One of the things that IACBE does is it provides that framework and those requirements for what we call assurance of learning and assessments of courses. So we go through every year and we will pick course, we'll pick the what we call artifacts or the samples of work from the course. We will independently review them against those requirements for the learning objectives. And so we're constantly tweaking that. I will tell you, I spent over 30 years in industry, including a role as a CEO and a COO. And I started as an adjunct. And one of the challenges as an adjunct is you teach practice. What I've learned from becoming a PhD and now getting an administration is that framework is critical, so that when a student learns something from a practitioner, they're learning things that are up to date and current, but they're also learning the theoretical or frameworks behind it, so that as it moves, independent of the university and that faculty member, they understand how to apply it. And I think that's what's unique about our program. I think HCA is a fantastic program that we have practitioners that have learning objectives that are constantly being revised, keeping the content current, but also making sure that we've got that scaffolding being supported for our students.
And Beth, let me turn to you, because as we were talking before we were filming, you were explaining to me your recent promotion. Congratulations in your current career trajectory. Can you talk a little bit about how having those experienced faculty in the classroom who have been through what you are now going through as a healthcare administrator and been able to share those experiences with you along with that theory has really helped you advancing your career and has helped set you up for what your current role is with Southcoast?
Sure, Jim. I really believe that the learning that I got from my professors really helped give me an overall greater understanding of all of the aspects of healthcare, so that when I'm interfacing with heads of departments, I know exactly what their struggles are and I can relate to what's going on. So for example, we have an attorney that is the director or executive director of risk management, and I can have intelligent conversations with her about some of the litigation challenges and how that interfaces with, different roles that our leaders are dealing with, our clinicians are experiencing. And I know what she's talking about and I can participate in a meaningful way. And I think before that, I would just be able to smile and nod. So I think it's provided me with a well-rounded plethora of experiences, because I have had that background now from the practitioners about each one of those topics. So when Dave was talking about that, healthcare law, for example, was a class that you learn so much in, and you really understand how what happens to patients can result in a really severe situation for a healthcare system, and how some of these mistakes might be able to be avoided. And I'm in charge of our peer support program. And when you think about all of these trickle down, if you have an adverse event or a medical error, how it affects everyone, not just the patients, but the practitioner, and what level of support the organization owes to provide to them. And not only from a litigation support, but an emotional support of what they've been through. So I feel like all of these learnings from Salve have increased not only my emotional intelligence, but certainly my ability to have impactful conversations at the table when I am in meetings with executives.
Yeah. Let me jump on that because I think you touched upon something that's a huge differentiator for Salve, which is our Mercy mission, our commitment to the critical concerns of the Sisters of Mercy, as well as our commitment to making sure that our training emphasizes ethical construct, emphasizes the humanism that goes along with healthcare, because I think sometimes in today's world, healthcare, you would think, would be a humanistic endeavor, but in a lot of organizations in healthcare, the focus on profit margin, the focus on delivery, the focus on structure, sometimes humanistic gets lost. And I think one of the great things about our program is because we're rooted in an institution that is so mission driven, it infuses everything within the courses. So David, can you talk a little bit about how our mission and our emphasis on ethical behavior is embedded within the coursework here at the university?
Sure. So first of all, we have a course dedicated to ethics for the healthcare professional. So that's the root of it. Beth has taken the course. She's smiling because our instructor, Lou Puglisi, is a highly interactive, passionate teacher of ethics, presents ethical situations. I think students present every week an ethical situation that they have to analyze and present. Beyond that, each of our courses has an ethical component to it. So in our finance area, for example, one of the controversies right now is universal health care for all as compared to our current system. Our current system is a market-based system. Universal healthcare is a social-based system. And so it is explored in the course as well as the intro course, what those systems will look like, what the payment reform would look like, what's appropriate, et cetera. So that's another couple of examples where ethics do exist. And the last thing I would say is on our student evaluations, students are asked, was the Salve mission presented and how was it presented? So there's that backstop sort of approach where we know that Salve is interested in seeing that. We know that students expect that, and then we're expected to deliver it in each course.
Yeah, I'm fortunate enough to be married to a physician, so I'm sort of in this peripherally every day, and that conversation about fee-for-service medicine versus, delivery for the purpose of the patient is something that comes up at our dinner table all the time, and how important it is that the focus has to be on the patient and has to be on the recipient of healthcare. And if you lose that mission, if you lose that frame of reference, then you lose the whole purpose of being involved in healthcare as an industry. Jessica, let me turn to you as a current student in the program. You're currently a nurse, which is an amazing and demanding career that understands this humanistic activity. And currently as an assistant clinical manager, you're both involved in your day-to-day nursing responsibilities, but you're also starting to take on more supervisory experiences. Can you talk about how this program is helping you as you take on greater managerial responsibilities, and ultimately how you think this program is going to help you in your career trajectory?
Absolutely. So when I started the Salve program, I actually was new to my role of assistant clinical manager. And as I'm going through the course, I'm having situations come up and it matches what Salve is teaching me. So for the first semester, I was actually in human resources, which I was so excited that I had that as a first semester course, because it gave me the opportunity to learn those basic foundation skills that I had to deal with as a manager. And new into leadership in healthcare, it's a hard time right now. It's something that I never thought nursing would be in the state that it was in. I started, thankfully, way before COVID a little bit. So I got to experience nursing prior to the pandemic. But now we're in a state that we have to look at our ethical decisions every single day of how are we going to have these patients hold in the ER and then try to get into our ICU beds and have the care that they need. And as a manager, you're advocating not only for your nurses, but also those patients to get that care that they need. And Salve teaches you how you can kind of analyze, but also support your staff at the same time.
I'd like to ask a question on top of this. So one of the things we talk about when we look at career trajectories is this difference between an individual contributor and a manager or an executive.
Mm-hmm.
And the fact that as an individual contributor, you learn all you can and you become as strong as you can, but you're in your specialty. And yet when you start into supervisory roles, you have to manage people that have the same skill set. And then when you get into executive role, you're managing people outside your skill set. You're at an interesting point right now where you're on the nursing track. So on the individual contributor side, you're seeing that, and now you're making that transition. Do you see that transition? Can you describe kind of what that's like when you go between your nursing experience and then the leadership experience?
Great
Absolutely.
question.
So I'm a newer leader, and I'm also a young new leader. So that gave a very interesting dynamic when I went into a unit that had very seasoned nurses. They have been in this career for 30 to 40 years.
Mm-hmm.
They know what they know, and I don't know what I don't know.
Right.
So had to take a step back and realize that they can teach me something, but I can also teach them something. But we both have to respect each other on an even playing field. We're all here for the same goal. Even though I may have different experiences and they have different experiences, together we're part of the same team. And at the end of the day, it's that patient that we admit and we're able to discharge home, or we're able to give that life-saving endeavor.
And David, one other follow-up on that. In our healthcare administration program, we also have a certificate program in healthcare leadership. And Beth is a graduate of the certificate as well as the degree, and Jessica is a student in the certificate as well as the degree. So in that certificate program, those 4 courses, students have the opportunity to really look into starting with their own leadership approach, leading their team, conflict resolution, and change management. So change is ever present in healthcare. So it's a constant in terms of applying the skills that people learn. And I think it's an opportunity to do that deep dive, moving from an individual contributor, which both of you were at one point, to being a leader in the organization.
I think one of the observations I make constantly about healthcare is that healthcare is the perfect personification of a matrix organization. Healthcare, certainly there are hierarchical organizational structures to it, but in terms of the day-to-day operations, it happens in teams, it happens in groups, it happens bringing people from different departments and different experiences and different roles together to solve problems, to both address patient issues, but also address organizational management issues. And that requires a level of facilitative leadership that I think sometimes gets lost in some programs that are looking at things like healthcare administration. And maybe Beth, you're the best person to address this because of your new role is really a perfect example of a facilitative role that is operating within the constructs of a matrix organization. Can you talk a little bit about some of the leadership skills that you've gotten from this program and how they've helped you to navigate this type of facilitation that's required to be successful?
Sure. I think that one of the main reasons that I selected the program at Salve was the opportunity to obtain the leadership certificate simultaneously with the master's in HCA. And that really appealed to me because I've been in leadership role for most of my career. And I have a coaching certification from International Coaching Federation. And I really grappled with what I wanted to do with my master's. Did I want to do something in organizational development and continue on with that type of trajectory with training? Or did I want to go more in the healthcare administration? And I really felt that there was a lot more opportunities and interest in healthcare administration, but I was so torn because I really wanted to have an additional leadership component and get some more education in that, even to supplement my coaching certification. And so when I talked to Dave and he was telling me that I could get the certification, and I started looking at the curriculum for the 4 classes, I just have to say I use all of those every day. The first class where you had to really define your mission and your values as a leader was so eye-opening because that's not something that you normally have time to reflect upon. And certainly not put into words. And having to do all of that work in that first class really helped me to understand how I wanted to show up and some of the values that I wanted to display to people and to help the leaders that I coach. So I really felt like all 4 of those classes were so robust in nature that you felt like you were in a 3-year program and you were just in basically a school year because of the 4 classes. The one that we learned about change management and with Cotter's 8-step model is something that is so applicable, and that I train people on how to go through a project and how to get people to buy into change. And since COVID, that has been such a useful skill. So I have to say all of the classes are really important. And right now we're doing a huge project for primary care. So primary care is one of the toughest hit areas with attrition and lack of engagement and conflict. So the conflict resolution class, I have to smile all the time, Dave, because we created a program called collaborative communication, which is basically how people deal with conflict. And we have a 4-step approach that we're using in that. And it's crazy how much I leverage everything that I've learned at Salve in my everyday existence, and how it really makes me stop and think. When Dave mentioned critical thinking, I feel that that's one of the areas that sets us apart at Salve from other universities, because there is such an emphasis and an expectation. When you're writing your papers, I mean, you have to really think and critically apply all of the concepts to real life situations. So you're not just writing an academic-based paper. It really is, how do you incorporate these concepts that you're learning in the classroom to your specific role? And you have to have examples. You can't just say your opinion. It has to be backed up by evidence and real life examples. And working with the students, we had a lot of teamwork and individual pairings that we had to do. And we had a great thing in conflict resolution where we were paired up and we did like simulated role plays. And those experiences make the learning really sticky. And then you can take that and use that in your everyday world. And then even the experiences from your professor, you remember stories and different things that they've applied. And so it really makes the learning more experiential rather than just theoretical.
When you both said that, because you kind of alluded to this as well in your talk, I remember when I went through my master's, I would tell people either I was earning a degree or I was getting the least expensive consulting I could ever get because we were applying, all the time. And I think there's a truth to that when you're going through the program. The ability to take your real world situations and apply them to your academic work is just so powerful. And learning from your peers.
Exactly. I was just going to say, and learning from your peers, because we have students who bring their experiences to the table through their questions, through their experiences. When Beth is talking about the conflict resolution course, that pairing is each student brings a relationship they write up a relationship from their work setting that they want to improve or one that is really in jeopardy. And then through the next 5 weeks, they apply the concepts from getting to yes and difficult conversations to that situation. And they get to know each other, they get to challenge each other, particularly after the first couple of weeks when they really know the role that they're playing. And they learn so much in terms of going through that from each other as well as from the concepts. And it's really a pleasure to watch that as they're going through that.
And Jessica, as a rising leader in this profession, could you expand a little bit on what your thoughts are around working with some people that may be more advanced in their career than you, but hierarchically you're now asked to manage them, or bring in physicians, bring in other care providers to manage the entire case experience?
Really. So I am part of the certificate program for healthcare leadership, and those classes are actually my favorite. They teach me so much on how to manage my team, but also how to be a good leader, down to listening. And the professors that teach these courses interact with you so well that the 3-hour Zoom class does not feel 3 hours. You're engaged the entire time, and you do have to bring real life examples. Like I brought to the table, this is what I dealt with this week. I have some questions about it. How can I better apply as a leader? And that classroom has a wonderful network. We have pharmacists, physical therapists, other nurse leaders, and then we have our professor leading us. And all of them have helped me in different situations. And then it also builds your network. I know through Salve, with my student networking, I can call someone at another healthcare facility and they're going to be able to help guide me because we have that bond through Salve. And that's something that you don't find in every program. That you get together for lunch after you finish a class because you work so well together. That's what Salve brings. And I've experienced that even I'm from the RN to BSN program here. That is what Salve is about, is bringing that community together, but supporting your future endeavors.
So let me bring it back to David's kind of nuts and bolts about the program. Who is sort of an ideal student for this type of program, be it the certificate program or the master's program?
Sure. So really, I would say a mid-career professional who wants to advance their career or at least better understand the industry that they're working. So we have administrative professionals who might come from different industries and now they find themselves in healthcare. And healthcare is loaded with acronyms and abbreviations
Yes,
and
it
things
is.
of that nature, and they can be flying all the time. So for that administrative professional, this is an opportunity, again, a safe space, concentrated information where they can pick up that information so that they can be effective. And then clinicians. Clinicians come to us with that great depth of knowledge, and they know their clinical area, but they haven't been educated in terms of the industry around them. So Jessica is a wonderful example of a talented clinician, knowledgeable clinician who is moving into management. And so how does she learn about those respective areas? And in terms of the certificate program, the certificate can be taken as a standalone program, 4 courses, all graduate level, or it can be taken, as Beth said, as part of the master's degree, using your 3 electives, and we substitute one of the elective courses, one of the required courses. So what that means is that a student graduates with 2 credentials and a concentrated area in terms of their respective interests. So that could be healthcare leadership, it could be cybersecurity, or if somebody wants to do a standalone, they could do healthcare administration. And if they do the standalone, they can apply those 4 courses to the graduate degree if they decide to go on with that.
And so it seems like we are providing a really strong foundation for anyone in any area of healthcare, whether it's on the purely administrative side or the clinical side, to advance, to become the leaders that are necessary for success in today's healthcare world. And I imagine there's also a strong ROI related to that in terms of salary.
Right, absolutely. So we have seen, Beth is an example of somebody who just was recently promoted, and we have seen other students who have moved on and been promoted and have stayed in touch with us in terms of networking. So we have that sort of feedback. And clinicians, administrative professionals, but also from different settings, from hospitals, from insurance companies, from physician offices, et cetera. So again, you get that sort of breadth of knowledge coming into the interactions with students.
I would also like to say master's degrees, especially this HCA master's degree and the certificates, are about enhancing your career, not about getting a job. And I think if you're a clinician, this provides different pathways for your career. If you're already on a leadership career path, this provides you more of the underpinnings to extend that career. But there's a lot of question today about what's the value of master's degrees. And I would say when you're talking about a job, it's a very different situation when you're talking about a career. Master's degrees are about extending and widening the path for your career. And I think the HCA is a great example of a very targeted master's degree that helps people do that on both ways, both clinical and within the administration job career paths.
So let's end with Jessica and Beth, because you are both recipients of these programs and have an understanding of what the benefits are. First question, would you choose Salve again if you were making this choice? And what advice would you give to someone that's trying to decide, 1, whether or not to do one of these programs, but 2, trying to decide on a place like Salve versus maybe another institution that they're looking at and those offerings are coming from?
Absolutely. So I absolutely would choose Salve again. I'm very proud to be a graduate of their RN to BSN program. So when looking at master's programs, Salve was my first school to look at. I originally actually was accepted to the nurse practitioner program here, and I thought I was going to go that route. And then some personal endeavors happened and life stopped for a little bit in order to focus on family. And when that happened, Salve called me every semester and said, we're just checking in, no pressure, but if you don't want to do NP, we have healthcare admin. And that's when they opened the door, and I met with David and we discussed that program of how it could help my future of what I was looking into. And as the pandemic hit, I looked how healthcare leadership needed strong leaders that were coming from the bedside. We had a mass exodus of nurses and leadership. So I felt that as an opportunity of, I need to take the experience of what I just went through for the last 2 years and bring it into leadership. And Salve was right there to support me for it.
Yeah, I think it's fair to say that there is a crisis in healthcare, not just on the provider side, but also in competent leadership that both understands what the needs are of today's healthcare world, but also that can bring in those facilitative techniques, that can look at matrix organizations and how they operate and improve them, that can think about the humanistic aspect of it, and to bring all of those skills to bear to help move an industry that right now is challenged and needs effective leaders in order to continue to move forward. Beth, I'll give you the last word.
Thank you, Jim. I would absolutely choose Salve again. I was just so excited to be a part of this, and I started thinking about it because I am the liaison for our educational partnerships. So I run the tuition and certification reimbursement program at Southcoast. And I was hosting a webinar with Dave, and we went through several, and I kept thinking, this sounds so great. Why am I not taking advantage of this? So I called Dave and I said, so why should I do this? And we talked about some of my goals and how I really wanted to enrich my original degree in psychology and business management and my coaching certification, and how I really wanted to be a more rounded healthcare administrator and be able to, like I said, have a seat at the table and say intelligent, relatable things for no matter what position someone's in. Because that's really where I find myself, is I'm interfacing with lots of different executives. And the fact that you could get the healthcare leadership was really a big selling point. But also the mission-driven nature of Salve attracted me, because Southcoast Health is a very mission-driven organization. And I felt that that combination between all of those factors made it the perfect choice for me. And I have a couple of close friends that got their master's degree from another place. And it seemed so different when we would talk about our different classes and what I was learning versus what they were learning. And again, how application driven and how practitioner driven and all of the benefits that we've talked about today. And it just helped me reaffirm every time we would talk that I made the better choice and that I really felt that Salve has the best option, and it's the total package. So I would say to anyone that's on the fence, call and talk to Dave. Understand what your goals are, understand what the program provides, and do your research and figure out what's important to you, and just know that it's worth the work. Because in the end, what David was saying is that you're ended up investing in yourself and your career. And I had no idea what would come from this. I was very fortunate to have this promotion, but I do know that it was a factor that I went and invested in myself and improved my educational landscape. And I know that they looked at that. And I think that it builds the confidence that you need to go out and be a healthcare leader when you know that you have that background in you. So I would say to anyone that's thinking about it, just go for it. Pull the trigger, make the call, start doing your research, and invest in yourself.
Well, thank you all for joining in this conversation today. This has been an edition of Seaside Chats. If you'd like to learn more about our healthcare administration program, just contact the Office of Admissions. We have a staff that is ready to help you through this process, to help you determine whether or not this program is the right fit for you, and ultimately help you navigate your way to earning a certificate or a degree at Salve Regina University. Thank you again for joining us, and we hope to see you on campus soon.